So my name's Neil Jolly. I'm an equine dentist. I'm currently here in Busan, checking some horses for some local trainers on behalf of the KRA. And today finds me here with this guy, and I've never met this horse before, so I'm going to ask the trainer what the problem is with this horse, and see if he can tell me a little bit more about the history of this horse, and then we can go from there. So if you could please inform me what the problem is with this horse, so I can get a better idea of what he's doing wrong, if anything. Is it a chewing or feeding problem, or is it a performance problem?
예, 이 말은 지금 현재 4세고요. 예, 지금 일본에 있는데 말이 지금 현재 약간 일본에서는 조금 보합세로 지금 있는 말인데, 지금 이 우리 그 호주의 그 말 전문 이제 덴티스트가 와가지고 또 치아를 교정함으로 인해 가지고 한 번 더 업그레이드 되기를 바라는 마음에서 지금 이제 치아를 교정하게 됐고요. 지금 이 치아는 이 말이 어릴 때는 2세, 3세 때는 뭐 4개월에서 6개월 이렇게 했었는데, 현재는 4살이라 나이가 들면서는 조금 이가 좀 덜 따는 것 같아요. 그래가지고 지금은 기간이 한 10개월 정도 된 것 같습니다.
Okay, so we've got a 4-year-old horse here, and he's lost a little bit of form in recent times. The trainer just wants me to have a look at the oral cavity to make sure that there's nothing there untoward that may be causing this. So we'll go ahead and hopefully he's a good patient. We'll see what we can find. Okay, he's nice and relaxed. It's always very important before we start is to get the horse nice and relaxed and to let them know that I'm not here to hurt them. I'm here to help them. And you can see he's very soft in the eyes, and he's paying attention. You can see that his ears are flickering a bit, so he's listening to what I have to say. So I think he's ready to start the service, so we'll get underway. Good boy. Okay, I'm just checking the incisors, making sure he doesn't have any injuries here before I put the gag on. We can see yet that he's 4-year-old. Okay, I'm just going to have a quick feel with my hand inside to see if I can find or feel anything untoward. Okay, it appears as though he's lost his premolar caps. We'll have a closer inspection when we put the gag on. What I do notice with this horse before I put the gag on is that he's standing up quite high in front, and what we mean by that is he doesn't have a bit seat, so that could be one of the reasons why that's affecting his performance under saddle. So what we're going to do is we're going to attempt to create a bit seat for this guy, and that will take a lot of the pressure off the soft tissues in his mouth, particularly the bars and the tongue and the mucosa. So that'll make him much more comfortable to ride with a bit in his mouth. Okay. So he's had dentistry before. It was about 8 months ago. So he knows what this is. It's always a good idea just to give the horse a good look at the gag. What's that, mate? What's that? Not going to hurt you? Good boy. So he doesn't seem to be too phased with that, so we're going to put that on. Good lad. Good lad. That's a boy. That's a boy. Just relax. Just relax. That's a good lad. Good lad. Good lad. So we just make sure that we've adjusted it right. Probably go up another hole. Okay. Steady, mate. That's a good boy. Steady, mate. Okay. Good lad. Good lad. That's a boy. Good lad. So I'm just going to have a feel inside. Steady, mate. Good lad. Good lad. Good lad. Good lad. Good lad. That's a boy.
My chicken.
Can check, yeah, of course. Okay, so we just got the trainer having a check now, having a feel. Okay, so before we start, I've had a good feel around inside. Now, the horse isn't suffering from any major pathologies or any major afflictions. He's got a little bit of mild ulceration, but his teeth are in relatively good shape. Here's a little bit sharp, so what we're going to do is attempt to take away all sources of oral cavity pain, and we're going to shape those teeth, remove all those sharp points, and we're going to fashion a bit seat for him. And hopefully, by doing so, this will help to improve the performance of the horse. That's a boy. Good boy. Now he's lost all his premolar caps. He's finished his capping stage, which is great. So he's got all his permanent teeth, and they're all in occlusion. Okay, so this is a back pedaler. Horses get sharp in two places within the oral cavity in particular, due to the way that they chew and the fact that their upper jaw is wider than their lower jaw, and their teeth continue to erupt throughout their lifetime. So I'm going to start on the lower jaw, where horses get particularly sharp, and that's on the lingual aspect of their lower arcades, which is the aspect closest to the tongue. So we're going to start there. This is a back pedaler. We're just going to introduce the tool nice and steady. That's a boy. Good boy. Good boy. Good boy. Now you'll notice that I don't put a lot of pressure on the horse or the tool when I do this. I try and let the tool do most of the work, and you can see he's pretty cruisy about it. He's nice and relaxed. Now the important thing as an equine dentist is we want to get right up the back on his last cheek tooth and bring that tool all the way forward to the first cheek tooth. Good lad. Good lad. Now this horse has got small ATRs, excessive transverse ridges, along the surface of his along the occlusal surface of his lower and upper molars. So we're just going to remedy that as well. Good boy. Now horses are prone to getting excessive transverse ridges because often they're fed off a manger on a wall and not from ground level, which changes the angle of the lower jaw, where the lower and upper jaw doesn't quite meet correctly. That's a boy. Good lad. You're a good boy. Okay. Just going to start on the upper jaw now. Now, horses get sharp, and sharp enamel points are created in the upper jaw on the outside, or the buccal aspect of their arcades. And the buccal aspect refers to the area of the arcade that is closest to the cheeks. Or the buccal aspect of the teeth is the area of the teeth, or the arcade closest to the teeth. So I'm removing these sharp enamel points now, and he's coping with that really, really well, like a good horse. That's a boy. You're a good lad. Good boy. Now I'm just remedying the ATRs, the slight ATR feel that he's got in his upper arcades at the moment as we speak. And removing the sharp points. Good lad. Good lad. Now in the process of removing these sharp points, we want to bevel that outside edge a little bit. And by beveling that outside edge of his upper arcades, that'll just help to make the work that I'm doing stand up for a longer period of time. Good boy. Good boy. That's a good lad. Okay. Okay, another important thing to remember when we're doing equine dentistry is that what we do to one jaw, we should attempt to do to the other jaw. So what we do to the left, we do to the right. And the reason we do that is so that we get an even feel on both arcades. The only time we wouldn't do that is if we're working on one arcade more so than the other because the horse has a pathology or an affliction that needs more work. But since this horse is just relatively sharp, or since this horse is just sharp and he has some ATRs, we can safely work on both sides of the arcade and have them both balanced. So with this tool that I've got in my hand, this is a really neat tool to get up and around the angle of the upper arcades and hit that last cheek tooth, which is very important. And it's the last cheek tooth on both sides, on the outside, that this horse is suffering mild ulceration to the cheeks. So we want to make sure that we get up on there and we hit those sharp enamel points and we remove them. Good boy. And you can see how well behaved this guy is. He's not sedated. He's not sedated. I'm a traditional equine dentist, so I work without sedation where possible. I rely on horsemanship skills. And this guy's coping with his service really, really well. Good boy. So here, using this particular tool, it's a push tool, a little bit different from the others. Steady, that's a good boy. And I'm just tucking the outside edge of them uppers, beveling them outside edges of the upper arcade on both sides, just tucking them outside edges underneath. And what this does is, like I said earlier, just enables the work to stand up for that little bit longer. Gives a nice finish to the arcades. And this horse is coping with this exceptionally well. Now I'm pretty happy with where we are at the moment. Now this horse is very high in front. He's got no roundup whatsoever. And I'm just going to invite the trainer or anyone else that would like to have a feel. You may just need to translate. Use his thumbs, Leo. Use his thumbs. And just find the second premolar. You can see it should be very tall and it's got points on.
쏙 들어갔네. 약간 들어간 거.
들어갔다고요?
Yeah, so what we want, we're going to bit seat that, take those sharp edges and just round the front of those second premolars to create a bit more room for the bit.
두 번째 전구치를 좀 낮춰가지고 제갈자리를 만들겠다고.
예, 그래서 좀 내려갔어 지금. Okay.
So, what we're going to do is we're just going to take some of the height out of these second premolars, bit seats should be placed in the mouths of all racehorses to alleviate any chance of performance issues under saddle. So at the moment, I'm just using this push tool just to drop a little bit of height out of them teeth to make the job of rounding up these teeth that much easier. Now, the important thing to remember as a dentist and for the welfare of the horse, we don't compromise this tooth in the process of rounding it up. This tooth is a grinding tooth, so we want to only be rounding up the rostral aspect and not compromising the rest of the tooth. Good lad. You're a good lad. Okay, so we've dropped the height out of that tooth now, and we're just changing. Now this is a round up tool, a tool that's specifically designed to help equine dentists such as myself to get the pattern and the shape of this round up the way we want it. Good boy. You're a good lad, aren't you? Yeah. So this horse is coping with this really well, considering he's got a large crowd outside his box, all looking in on him. He's got a camera only a couple of feet away from him. And he's coping with this exceedingly well, aren't you, mate? You've got a great temperament. He knows I'm not here to hurt him. He knows I'm here to help him. And he's going to be a lot better for the service. I'm just hitting across the front of these teeth now, these second premolars, just the shape, to get that shape that we require. And he's a good lad, aren't you? Good boy. You're a good lad. Okay, just a little bit more. So we're working down on gum line right now, which can be a little bit uncomfortable for the horse, but he's coping with this really, really well. Really well. Good boy. So we're just about finished his offside, which is the side I'm working on at the moment. Okay. Now that hasn't taken very long at all, and the offside round up is essentially done. So I'm going to move over to the near side and do the same. And like I said earlier, what I do to the offside, I do to the near side. So I want this near side bit seat to be a carbon copy of the offside bit seat. And the reason we do that is so that the horse is balanced, has a balanced arcade. Therefore, when the rider's on board, if the rider can control the oral cavity and control the horse's mouth and it's balanced, then in all likelihood the horse itself is going to be balanced and it won't be uneven in his gait, which is important for the racehorse who's racing around turns and also in straight lines. And also when he's racing in company in large fields. We want the jockey to be able to control him, and we want the horse to be able to listen to the pilot on board. And part of that is getting his oral cavity balanced, and that's what I'm doing right now. Good boy. Okay. Now both of those are in fairly good nick. Now I've just going to my last tool here. Now this last tool is like a polishing tool. If we talk about diamonds, we shape a diamond and then we polish it. Well, this is no different. I'm using this tool to polish that roundup and take off any minor imperfections and make it nice and smooth so he doesn't suffer any pain or discomfort with the bit in his mouth. So again, you might have noticed that I put very little pressure on the horse. The horse hasn't moved at all during the entire service thus far. And part of that reason is I don't put too much pressure on him. He's accepting the surface, and I'm letting the tool do the work without much pressure at all. You're a good boy, aren't you? Eh? Good boy. Okay. That's a good lad. That's a good lad. That's a good lad. Okay, I'm just about ready to invite the trainer in again, and he can have a feel of his horse's new teeth. And hopefully he's happy, because if he's happy, I'm happy. I'm sure the horse is going to be happy. Steady, mate. That's a boy. Okay. Okay, would the trainer like to come in and feel his horse's new teeth? Okay, just feel those first lowers there, the round up. Nice and smooth.
I will tell the other grooms to touch, okay?
Oh, thank you.
You feel that?
Yeah.
Much
Good.
different.
Good.
Yeah?
많이 좀 달라진 것 같나요?
Much different. Okay, so this horse is essentially finished with the gag on. I'm just checking the rest of the work now before I shut him down and take this gag off to finish his upper roundup. And I'm just making sure that there's nothing there.
다 끝났는데 다시 한번
Okay,
건너가지고 확인해.
there's a couple of minor ledges there, so I'm going to use the back pedaler just to remove these indentations in his teeth. Now these indentations have been caused due to him biting down on the bit during his track work and his race day. Okay, nearly done, mate. You're a good boy, aren't you? Okay, looking good. Looking good. Well done. Okay, I'm very happy with that. So, we'll take the gag off. Horse has been exceedingly well as a patient, haven't you? You're a good lad. You're a good lad. I wish they were all like you. Yes.
Thank you.
So, okay, so all I have left to do now is to fashion his first upper, second premolars into a bit seat as well, and then the service will be completed. So, good boy. So I'm hitting outside the second and third premolar, predominantly the second at the moment, and just shaping that these upper teeth so that there's more space for the bit, and also in efforts to alleviate undue pressures on the soft tissues of his mouth. Good boy. Okay, that's the near side done. Now we're just going to the off side. Again, I'm just hitting outside that second upper premolar, tucking that outside edge under, and just hitting across the front now. Just gently. That's nice and gently. And creating that rounded form we want in the tooth. You're a good lad. Yes, you are. You're a good lad. Oh, that's better, isn't it? Okay. So again, I've just got the polishing tool, and I'm going to finish that off. Finish him off just with this tooth, just to get rid of any minor imperfections. Good boy. Good boy. So let the tool do the work. Okay, steady mate. Wow, how's that? Okay. Okay, the service has completed, and this horse has dealt with the surface really well. And what we've been able to achieve is we've been able to remove all sources of oral cavity pain, remove all sources of enamel points, particularly those points that have been causing that mild ulceration to his cheeks, and we've also been able to fashion a bit seat. So this horse is going to be a lot more comfortable whilst masticating his food intake, which is very important, because if he can't masticate his food intake properly, then he can't get the nutrition out of his feed, and that affects performance. He can't turn that carbohydrate intake into energy, the energy he needs to race. The other thing we've done is we've created a bit seat. Now the bit seat creates more space for the bit, alleviates undue pressure on the soft tissues of the oral cavity, which will enable this horse to perform better with a jockey on board and a bit in his mouth. So he's in a lot better condition than when we first started prior to the examination. So thank you very much. I hope you enjoyed it and you get something out of it. Cheers.
Thank you.